In the United States, colorectal cancer is the fourth most common cancer in both men and women. Dr. VanderMolen of Hoag Memorial Hospital Presbyterian in Newport Beach stresses the importance of screening and, if diagnosed, what treatments are available.
Colorectal cancer is a cancer of the large intestine. Most cases of colon cancer are sporadic. There are some hereditary cases. Certain kindred, certain families have hereditary polyp syndromes where there's an increased propensity or susceptibility to colorectal cancer. But most are sporadic. It may be associated with obesity, it may be associated with inactivity or sedentary lifestyles, and it may be associated with sort of a soft diet, a diet low in fiber. Most common early symptom is blood in the stool or black stools, which is old blood in the stool. You could have abdominal pain, cramping, could have a change in bowel habits. Someone who may go from having regular bowel movement once a day or every other day, who suddenly starts having 2 or 3 bowel movements a day, or maybe even starts to have constipation, a bowel movement every 3 or 4 days, a change in the pattern of bowel movements, weight loss, loss of appetite. Those are the most common presenting symptoms. The treatment options for colorectal cancer are somewhat directed or determined by the stage. The earlier the stage, the more likely surgery will play a major cornerstone or play a major part in the treatment. In more advanced stages, it's a whole body treatment, systemic treatments like chemotherapy or more of the backbone of the therapy. There are several screening tools, 4 different screening tools to look for colorectal cancer or to try to detect it early, even try to detect it in patients before they're symptomatic. The simplest is just to check stool for blood, to do a stool test for occult blood. A second way to test or to look for colorectal cancer is with what's called a barium enema. The best way to detect it is with what's called a colonoscopy, which is a fiber optic scope that can look completely through the colon. Through that scope they can see if there's any abnormal growths, and through that scope they can actually remove any polyps that might be at risk for developing into cancer. So not only can that be diagnostic, but it can also act to prevent colon cancer. Services provided here at Hoag with regards to colorectal cancer would include our hereditary genetic screening program, which helps identify patients who are at risk for genetic components, putting them at risk for colon cancer. We also have a dedicated team with a coordinator who follows colorectal cancer patients from the time of diagnosis through their treatment, sort of marches them through from surgery. We have specialized colorectal surgeons, and then takes them through the process of surgery and finally into any treatment that they might require post-operatively. With early detection, that's really the key. Patients who are at risk should get screening. Across the board, everybody should get a colonoscopy by the age of 50. If you have a family history of colorectal cancer, if you have a first-degree relative, once it is detected, there are new and better treatments that have dramatically improved long-term survival and cure.